The following presentation is a community analysis of Plant City, Florida. The objectives of this slide are to review a historical overview, community analysis, prioritize community needs, and global community health issues. Plant City had its earliest settlers in the mid-1800s. Its original name was Ichpuksasa after the Indian village that once resided there. In 1884, the South Florida Railroad was extended into the town by Henry B. Plant. Although it is often believed that the city was named because of its ties to agriculture, Plant City was named to honor Henry B. Plant for his contributions to the city. The railroad and train depot were large contributors to the community's transportation and growing agricultural development. The city was incorporated in 1885. In its early years, Plant City was known for cotton, corn, and citrus crops. Strawberries were originally grown in backyard gardens, but grew in popularity among farmers due to the ease of growth in the mild climate. The area farmers decided to make the change from cotton to strawberries, and they became the primary winter crop in the area. Today, Plant City encompasses 27 square miles of land. According to the 2010 census, the population of Plant City was 34,721 residents, with a population density of 1,277 residents per square mile. Tourism in the area is busiest during the winter and spring months thanks to the annual Florida Strawberry Festival and the International Softball Federation, which attracts visitors from around the nation. Plant City has various structures throughout the community. The community has several schools in the area, both public and private. There are elementary, middle, and high schools, as well as the Hillsborough Community College campus. The public library is located centrally across from City Hall. Public libraries contribute to the health of the community. According to Borman, approximately 37% of patrons using library computers are researching healthcare-related topics. Libraries provide a vital service that links the community to this valuable information. The community has several churches to meet the religious, spiritual, and physical needs of the community. Churches in the area provide services such as monthly wellness checks, blood pressure screenings, and dietary information that benefit the community's health. Several churches in the area also provide services such as food banks and thrift stores to help those in need. Plant City offers low-income housing options for the community through the County Housing Authority. 24% of Plant City residents are on public assistance compared to 19% statewide. According to the U.S. Census, Hispanic residents account for 31% of community residents living in poverty. The high rate of Hispanic residents living in poverty within the community correlates with the high number of Hispanic migrant farm workers in the community. This nurse believes that there is a link between low-income housing and poor health outcomes. Studies show that individuals living in low-income and public housing are at an increased risk for physical activity, increased morbidity, and increased health disparities. The community is also lacking in several areas, including lack of homeless facilities and art or history museums. The median household income in Plant City is approximately $45,000 per year. Approximately 40% of the community is on public assistance or living below the poverty line. This nurse believes that there is a correlation between community poverty and education. Plant City has a 9% rate of high school dropouts, which is 2 times the state average, and also a low rate of individuals with college degrees. This nurse believes that there is also a correlation between the high rate of high school dropouts and the population of Hispanic migrant families. According to local school administration, migrant Hispanic students face many obstacles to completing their education, including parents with no high school diploma, low family income, frequent moves, and low grade point averages. Plant City is a community with a large number of Hispanic migrant workers. These workers face many barriers to health care, including limited language proficiency, lack of access, and inability to miss work due to decreases in pay. Other communities with high numbers of Hispanic migrant workers face similar healthcare challenges. According to McCullough, Stanton, and Foley, seasonal farm workers don't see the value of preventative services, therefore they often go untreated. This nurse believes that mobile medical units would be a great option for these members of the community. Studies show that mobile medical units increase the likelihood that these individuals will have access to health care, prevention services, and education without missing work. Plant City has various healthcare resources available for all members of the community. The facilities vary in affordability and access depending on an individual's individual insurance coverage or ability to pay. There is a hospital, a local health department, and a community clinic. Plant City has a noticeably large number of walk-in clinics. This nurse believes that while walk-in clinics offer a great service, they should not take the place of primary care. Studies show that primary care improves the health, quality, efficiency, and affordability of healthcare in a community while reducing health disparities. The community also has several skilled nursing facilities and home health agencies. Healthy People 2020's community objectives that apply to the health of Plant City are as follows. HDS1's goal is to increase the overall cardiovascular health. The leading cause of death in Plant City is heart disease. Education is key to improving the cardiovascular health of the community. TU1 and TU2's goals are to reduce the use of tobacco use among adults and adolescents. While completing the windshield survey, I observed many individuals, adults and teenagers alike, smoking and using chewing or smokeless tobacco products. This is important for the community because cancer is the second leading cause of death. OSH2's goal is to reduce non-fatal work-related injuries. Plant City is an agricultural community. Agricultural workers are at an increased risk of injury due to exposure to pesticides and fertilizer products, as well as injuries related to repetitive motion and overexertion. Plant City has many parks, recreation centers, and trails that are maintained by the city. There are a total of 8 athletic facilities, 17 parks and playgrounds, and 2 recreation centers. The athletic facilities offer a variety of sports, including soccer, softball, baseball, basketball, and skateboarding. The facilities offer residents of the community a place to increase physical activity and promote wellness. Studies show that communities with parks and green spaces have a higher number of residents who are physically active. The Plant City Police Department employs 67 full-time officers. Unfortunately, Plant City's crime rate is 43% compared to the state crime rate of 31%. City Manager Michael Herr states that the city would like to increase the number of police officers on patrol in the community. However, the budget does not allow for the expense at this time. Plant City has 2 fire rescue departments within the city limits. The police and fire departments promote various safety programs within the community, including car seat safety checks and fire prevention education. The city also provides water and sanitation services to its residents. The 2014 annual water quality test showed no violations in this area. The city is run by a commission that is made up of elected officials. The commission is responsible for developing and enacting policies and ordinances by vote that will better the community. City commission meetings are held twice a month on Mondays and are open to the public. Members of the commission can be easily contacted via email or phone. For the city official interview, I was able to contact the city official via email and scheduled an interview for the following day. According to the city manager, the commission members are accessible to the community and they welcome their input. According to City Manager Michael Herr, the lack of homeless provisions in the community is a public policy concern. Mr. Herr states that some residents cite it is illegal for individuals to loiter in the community parks, and other residents want to find ways to help those in need. While there are no shelters in the community, daily free meals can be found at the Plant City Winter Visitor Center. Mr. Hurst states that there are no plans to make other accommodations for this population group, such as shelters. Alternatively, he states that the county provides social services to assist those in need of emergency placement due to financial crisis, and neighboring communities such as Brandon and Lakeland have shelters available. A community nurse in this area could attend this function at the Winter Visitor Center and provide education and healthcare services, as well as refer individuals to places where other valuable services could be attained. This platform could be a one-stop shop for education, vaccines, and prevention measures to improve the health of the homeless population. The prioritized community needs are obesity, smoking cessation, and lack of access to healthy food choices. While conducting the windshield survey, I observed large numbers of individuals that were obese, as well as individuals smoking in public areas. The windshield survey also revealed the community's lack of access to whole foods and healthy food choices. During the windshield survey, I did not see any produce markets within the city limits, but passed various fast food restaurants in the area. In a community where heart disease is the primary cause of death, education about heart health, smoking cessation, weight loss, and healthy food choices would be a great benefit to this community. Alcohol consumption. During the windshield survey, I passed more than 15 establishments that serve or sell alcohol. Studies show that alcohol consumption is associated with poor health outcomes and increased crimes in a community. Education about the risk factors associated with alcohol consumption could improve the community health and reduce the crime rate. Pesticide exposure. Plant City is a large farming community, therefore there is risk of skin and respiratory pesticide exposure. The exposures can also affect the family of those that work with pesticides. A community nurse could provide education about preventing skin and respiratory exposure through proper use of personal protective equipment. And finally, homeless provisions. The community has no homeless provisions. Studies show that a homeless population is more likely to have multiple health issues, including mental health and substance abuse, and less access to health care. Mobile health units that offer a variety of services in one location would be a great option for serving this population group within the community. The global community issue that also relates to Plant City is heart disease. According to the World Health Organization, the Centers for Disease Control and Prevention, and the Florida Department of Health, heart disease is the leading cause of death not only in Plant City, but in the state of Florida, the United States of America, and worldwide. According to the World Health Organization, 17.5 million people die each year from heart disease-related illnesses. The World Health Organization and Florida Department of Health promote early recognition and treatment of heart disease through education about modifiable risk factors such as weight loss, healthy diet, and smoking cessation. According to Huang, there is a continued need for education and health promotion related to the risks associated with heart disease. Community health nurses can meet this need for educating the public about prevention, treatment, and risks associated with heart disease in the communities they serve. Thank you.